Hi everybody, it's Dr. Cantor. I'm here with Sharon and Flavia today, and Sharon had a structural problem in her back. One bone was actually physically falling off of another, and we structurally rebuilt that. We had to go in and take the pressure off the nerves, put the bones back together, and reconnect them. And what we're talking about today isn't the actual surgical procedure. What we're talking about today is how to actually get better. So when you do a procedure like that, she had a problem initially that caused her bones to actually physically separate and break. What we don't want to do is fix it and have her create the same problem. So what Flavia does is Flavia is a therapist that uses a special therapy called Schroth technique, which really makes patients understand how to protect their spine, trains the brain to actually protect the joints. So when the spine is moving, what we don't want is the joints to move out of place. We want to get the muscles to be tight around the joints. So when you move in different positions, you actually are protecting the spine versus potentially causing other injuries. So how do you feel? What were you experiencing before, and how do you feel now?
Yeah, I mean, before surgery, it got to the point where it was unbearable. I had a constant stabbing in my back. The pain would wrap around my hip, go down my leg. I got to the point where I couldn't even stand for periods of time. I couldn't sit for periods of time. I couldn't stand for periods of time. I was constantly having to just take the pressure off of my back. And since surgery, I literally feel like a new person. I feel stronger than I did before surgery. I am in hardly any pain. I can stand, I can go out and wear heels with my girlfriends, and I still stop and pinch myself sometimes. Like, I was doing a class the other day in Houston for work, and I stopped for a minute and said, I can't believe I've been standing here for like 3 hours and I have no pain. So it is unbelievable. I can't thank Dr. Cantor, Flavia, this entire practice enough. It's been the most incredible experience.
Well, we can't thank you enough. We certainly appreciate your confidence.
Thank you.
So basically what we did is she had bones that are moving. So what we did is we took the pressure off the nerves ultrasonically. We reconnected them without interfering with any of the normal structures. So the goal in surgery is to fix the problem and don't screw up something else. So we reconnected the bones, saved all the natural tension bands, and we're able to get her in a good spot. So what's your role in this, Flavia? So now that we've got her better, she's completely healed, what do you do?
So after you fix the bone position, what we'll do is, first of all, educate the patient. This is the most important step of the way, right, Shannon?
Yes.
So everything is about education, how you will deal with the muscles, with your daily life activities, how you will use your muscles correctly. So we have to strengthen the muscles, yes, but education is a crucial point on this journey. So use the right muscles to do the right movements, and from there, it's easy
From there,
to
it's
keep
just
going.
magic. Yes.
So a lot of patients think that, okay, I'm gonna do a procedure and I'm gonna go back and I'm gonna do something aggressive again. And the answer, we want you more aggressive. We want you more fit than you were. Pilates is great stuff, yoga is great stuff. It may not be in its regular form the best for you. So Flavia is a Pilates instructor, she's a yoga instructor, she's also a Schroth instructor. So we take all of these modalities and we essentially mix them together to make a program that's gonna allow you to be really fit without re-injuring yourself. So going out after surgery and going as hard as you can and stretching as much as you did before may not be what's right for you. Now, some people can go back to normal activity. Some folks like you that broke a joint before, you need to not break the next one. So you look great.
Thank you.
Good job. Appreciate your help, and thank you.